Boris Johnson has announced that England will once again enter a period of lockdown tonight to be enforced by law from the early hours of Wednesday morning. In a televised address from Downing Street, the Prime Minister said he believed this was a pivotal moment in the fight against the pandemic and that the weeks ahead would be the hardest yet. England has now joined Scotland, Wales and Northern Ireland in implementing tougher new restrictions, faced with a surging number of new cases. Mr Johnson said that people living in England should stay at home and could only leave for exceptional reasons. Those include shopping for essential items and going to work where people can't work from home. Like in the previous lockdowns, outdoor exercise is allowed. Those who are extremely clinically vulnerable are being asked to shield again. And all schools in England will be closed to most pupils with online learning until after the February half-term at the earliest. And most GCSE and A-level exams are not likely to go ahead in England this year. But on this day of unrelenting gloom, there is nonetheless a significant cause for hope because the Oxford AstraZeneca vaccine has started its rollout today, following Pfizer last month, with a plan to vaccinate at least 10 million people by mid-February. More on the vaccine in a moment, but first our political editor Laura Kuenssberg on the day's events.
Since the pandemic began last year, the whole United Kingdom has been engaged in a great national effort to fight COVID.
An effort that isn't over, not even close, as Downing Street points the finger of blame at the new variant spreading fast.
As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic. With most of the country already under extreme measures, it's clear that we need to do more. That means the government is once again instructing you to stay at home.
That includes children who he said should go to school just this morning. Our kitchen tables or shared sofas become offices and classrooms again.
Primary schools, secondary schools and colleges across England must move to remote provision from tomorrow, except for vulnerable children and the children of key workers.
This might feel agonisingly familiar, but there is one big difference.
We're now rolling out the biggest vaccination programme in our history. By the middle of February, if things go well and with a fair wind in our sails, we expect to have offered the first vaccine dose to everyone in the 4 top priority groups.
Nearly 14 million offers planned to the most vulnerable and the most elderly. The doors could be unlocked in about 6 weeks, but there's a list of big ifs.
If the rollout of the vaccine programme continues to be successful, if deaths start to fall as the vaccine takes effect, and critically, if everyone plays their part by following the rules, then I hope we can steadily move out of lockdown, reopening schools after the February half-term and starting cautiously to move regions down the tiers. I want to say to everyone right across the UK that I know how tough this is, but now, more than ever, we must pull together. The weeks ahead will be the hardest yet, but I really do believe that we're entering the last phase of the struggle, because with every jab that goes into our arms, we are tilting the odds against COVID and in favour of the British people.
So with the force of the law, most of life will retreat again behind closed doors. Chairs on tables, empty streets, silent dinner halls, corridors falling quiet in every corner of the UK.
I know that the next few weeks will be incredibly difficult. I'm sorry to ask for further sacrifices after 9 long months of them, but these sacrifices are necessary.
These are decisions that politicians never wanted to have to take again. But choices they've made because beds, wards and hospitals are filling in a way that could threaten all kinds of care.
We cannot keep going in this direction or our National Health Service will fall over. It will not be able to cope with what is going on, and I'm quite sure our community does not want us to be in that situation.
The measures for England will come into law in the early hours of Wednesday. MPs will have a vote after that, but there's unlikely to be much resistance.
These measures are necessary, sadly, and therefore we support the package of measures that the Prime Minister has just outlined. And I think whatever our criticisms and challenges of the government, we've all got to pull together now to make this work.
Follow me.
Hi, Janice. Morning. Good morning, everybody. Hi.
This time, the hope, a needle in millions of arms, provides the way out of all of this. But the lockdown we'll live through first is far from being a quick sting. Laura Koonsberg, BBC News, Westminster.
Well, as I mentioned a short while ago, all schools in England will close to most pupils from tomorrow until the February half-term at the earliest, and summer exams, GCSEs, A-levels, will mostly be cancelled. Our education editor, Bronwyn Jeffries, has more details.
Some schools did not reopen today, staff too worried about the new variant of COVID. Tonight, the Prime Minister accepting the virus spreads in schools.
And I want to stress that the problem is not that schools are unsafe for children. Children are still very unlikely to be severely affected by even the new variant of COVID. The problem is that schools may nonetheless act as vectors for transmission, causing the virus to spread between households.
For secondary schools and teenagers, another massive U-turn. GCSEs and A-levels will be cancelled. Emily, due to sit 7 GCSEs, and her mum Nicola were stunned.
I was just really shocked and really upset. I felt like I've done so much work. The GCSEs have been like my whole entire goal for 2 whole years. I don't know how the teachers are going to, I don't know what evidence they've got now and what the plan is. There's nothing, there was a statement and then nothing else. So we feel like the rug's been pulled out from under us a little bit now.
For children just reunited with friends, now more remote learning at home. Education unions say it's the right decision, made late.
We've thrown together thousands and thousands of families today for a day and exposed them to that risk of infection, and whether that was necessary or not it is now called into question. What the government's really got to do is work with the profession. We can see things happening on the ground before it comes through in data sets.
Right. This primary school in Warrington was open today. They are ready to stream lessons online, but say that's a challenge for many families.
Children find it very difficult to access the live streaming lessons that we offer online. Our online offer is a very strong and robust offer, but it doesn't mean that all our children will be able to access it because they don't have enough devices or they don't have the internet capacity.
A primary teacher, Owen, is at home recovering from COVID. A pupil tested positive at the end of last term. By the new year, Owen was in hospital. He says the Prime Minister had to act.
I was pretty scared at some point, and especially when I looked around the ward. I was in this acute ward for I think we've got to get a lid on it, and as quickly and as securely as we can before start really opening schools and things back up again properly and fully.
Everything has changed for them this year. Now it's changing again. Bronwyn Jeffries, BBC News.
So let's go live to Westminster and talk to our political editor, Laura Koonsberg. Laura, let's put today's events into the context of action now being taken in all 4 nations of the UK.
That's right, Hugh. An action that politicians in every corner of the UK wanted to avoid at all costs. There's no question about that. This is something that politicians were very, very reluctant to do. But very strong statements publicly, and I understand a pretty strong push privately from all of the chief medical officers across the country, basically left politicians feeling that they had no choice really but to take more of our choices away from all of us, and to once again say that the country has to stay at home. You can see from the numbers and statistics that we've been hearing about today how this new strain of coronavirus hasn't just gone up gradually in a graph. It's not just even gone up in a strong curve. It's almost going up in a straight line defying the kind of expectation that anybody might have had of it, and the knock-on effect of that on the health service is there for all to see. So the fact is that politicians have come to this place reluctantly, but they have felt that they have had no option but to take this. Now, for Boris Johnson in particular's critics, this will see as more evidence of him only wanting to make decisions at the last minute, always being caught behind the curve rather than being out in front of the pandemic. I think even his supporters would acknowledge that he is more comfortable being the deliverer of good news rather than wanting to confront things that are really bad and difficult to hear in public. But just remember, though, while COVID is absolutely at the forefront of politicians' minds right now, the impacts that come along with another lockdown like this, pressure on the economy, the impact on kids being out of school, and of course pressure on other kinds of health beyond the pandemic are very, very serious too. These decisions are not ones that have been easy to take for any of our leaders.
Laura, many thanks again. Laura Kuenssberg there with the latest for us at Westminster.